What is a drug? A drug is defined by U.S. law as any substance other than a food or a device that is intended for the use in the diagnosis, cure, relief, treatment, or prevention of disease, or intended to affect the structure or function of the body. Drugs are divided into two categories, prescriptions and non-prescription drugs. Prescription drugs are those considered to be safe for use only under medical supervision, and non-prescription drugs are over-the-counter drugs. Dietary supplements such as herbs, vitamins, minerals, and other plant-derived material that are intended to supplement the diet are not medications. They're supplemental material. They do not require FDA approval, Federal Drug Administration approval, nor do they meet standards for safety or effectiveness. However, if they're used incorrectly or in excess quantities, they can cause harm. Now, every drug has three names. They have a chemical name, a generic name, and a trade name. And on the next page, an example. N4-hydroxyphenylacetone is the chemical name. Acetaminophen is the generic name, and Tylenol is the trade name. And you know it by Tylenol. But here's another common one that you know, and that's 7-chloro-1,3-dihydro-1-methyl-5-phenyl-2-H-1,4-benzodiazepine, which is generically diazepam, and the trade name is Valium.
Where do you learn to pronounce these things?
In the first grade chemistry. Now, what's a placebo? A placebo is a pill made to look exactly like a real drug, but it contains only an inactive substance, sugar or starch. Despite there being no active ingredients, many people who take placebos feel better, and some of them have side effects from the pill. Why does this happen? Well, many medical conditions come and go with time. So the person may coincidentally feel better or worse. And the placebo may be credited for the improvement, or it may be blamed with side effects. And if you look at the studies which are done on a medication on one column and a placebo on another column, and the side effects, nausea, headache, fatigue, insomnia, and so forth, you see that there are a significant number of people who take placebos that have side effect symptoms. So it's very difficult. It's not difficult to understand, but it's primarily because of suggestion. But it does occur that way. If you compare the side effects of the placebo with the side effects of the effective drug, and then you match it up to see if it's what you want to use as an effective medication. Now, how do we get from the laboratory to the medicine? There are three phases that you go through to get FDA approval. After a drug is identified or designed, and most drugs nowadays are designed, it is studied in laboratory animals to gather information about how it works, how effective it is, and what side effects or adverse reactions it may have. If it seems to be promising, the application is made to the FDA, and if it's approved, it can be ready for clinical studies in people. Phase 1 evaluates the drug's safety and toxicity in people. The small doses are begun, and they're increased to determine at what level toxicity may first appear. Phase 2 evaluates what effect the drug has on the target disease that you're trying to treat. Now, getting animals in the laboratory to have a specific disease is a rather easy thing to do, especially among the animal specialists. And so they can develop a disease in a particular animal and then try various medications to see what improves it. If a drug is effective in animals, that does not mean it will be effective in people. Phase 3 goes to people in large numbers who have the particular target disorder that you're trying to treat. And this phase compares the drug against an already established effective drug or a placebo. If the studies indicate that the drug is effective and safe, a new drug application is filed with FDA, which reviews all the information and decides on approval. It then may be marketed to the public. Now, this process takes 10 years. And there's an average of about 4,000 drugs which are studied in the laboratory every year. And about 1 in 5 is approved and marketed. So there's very few drugs coming out each year compared to the number which are being studied in the laboratory and in phase 1 and possibly 2 of this procedure.
How long did you say it was? 10 years?
It takes 10 years. From the time you have an idea, I think I will develop this chemical which will do this thing for this particular problem. And it takes about 10 years to accomplish that. Now, once a new drug is approved, it's monitored for side effects, and if new evidence appears, the FDA may withdraw the approval. Now, I'm going to go to this. Now, this top one is rosiglitazone. And the generic name is Avandia. And I'm going to read to you from the New England Journal, August 26, 2010, by Dr. Clifford Rosen. And the title is Revisiting the Rosiglitazone Story, Lessons Learned. The drug came out in July of 2006. It's a treatment for diabetes, for type 2 diabetes, and it is supposed to and does control the blood sugar very nicely. And you'll see what problems arise in a moment. So in 2006 it came out. In July 2007, 24 members of the Endocrinology and Metabolic Drug Advisory Committee and the Drug Safety and Risk Management Advisory Committee of the Food and Drug Administration had a joint meeting which Dr. Rosen chaired. And they concluded that this drug, rosiglitazone, which is used for treating type 2 diabetes, was associated with an increased risk of heart disease, myocardial ischemia, heart attacks, general cardiovascular problems. The decision in July of 2007 of these 24 people was that the drug should be kept on the market, but that patients and providers should be informed of potential cardiovascular risks. Now, what the FDA does when this occurs is they put a black box warning on the drug. And the black box warning is to tell people that, yes, this is an effective drug, but it has potential side effects. Now, that's in 2007. Now, 3 years later, in July of 2010, 33 members of a joint advisory committee met for 20 hours over 2 days to further advise the FDA about this drug, and they agreed that it had significant cardiovascular risk, and it was taken off the market. So you can see that from the onset of when the drug was started in 2006 to 2010, 4 years went by before they were able to tell you, yes, this drug has problems and maybe it shouldn't be given to patients. So it was taken off the market. Now the second drug up there is pioglitazone. Now pioglitazone, the trade name is Actos. And Actos was advertising in magazines and on the TV that this lowered blood sugar, but it did not cause cardiovascular disease. And that's wrong, because it's the same, it's actually the same family of drugs, glitazone, just minor chemical changes. But with marketing, you can go and say, this is better than what you had before without the risk. But that isn't exactly true. Now,
So is this okay to be given?
well, it was given. But the question is it good enough that everybody with type 2 diabetes should take this? And the answer is no, it isn't. It's better than the top one, but it isn't the best. It still has these significant problems. And so in another article in February 23 of 2011 from the AMA journal, this is what they wrote. They say both of these drugs increase the risk of a significant weight gain and lower extremity edema and have been associated with accelerated bone loss and fractures among women. They both have a black box warning about the risk of heart failure and cardiovascular disease. While this may not have as much risk as the other drug, it still has a significant risk, and the conclusion was that they shouldn't use either one of these drugs, but they should go back to what was used prior, which is metformin. And metformin is safer, it's tolerated better, and it costs much less. I should point out that every time a new drug comes out, the cost goes up, especially when they're marketing it on TV and magazines and things like that.
Did those newer drugs have features that made them seem to be preferable?
Yes,
Price?
yeah.
And
They seem to control the diabetes better, seem to.
are there cases in which the adverse effects of the newer drugs are offset by the benefits?
Well, obviously, yes, but even if you have a better drug to treat your diabetes, but you have an accelerated risk of cardiovascular disease, you're not accomplishing what you're trying to do. Because what you're trying to do is to avoid because we know that people with diabetes develop significant cardiovascular problems in their legs, in their brains, in their hearts. We know that, in the kidneys.
Were there deaths involved?
I can't tell you.
Okay.
Obviously, the deaths involved if you're talking about heart attacks and myocardial ischemia. Now, back to the drugs. The main goal of drug development is effectiveness and safety. And the difference between the usual effective dose and that dose which produces severe or life-threatening side effects is called the margin of safety. A couple of examples. Penicillin has been used for, what, 50, 60 years now. And it can be used in massive doses. Several million doses of penicillin, or 7 million units of penicillin can be used with impunity. There is it's a drug which you can use in large amount without worrying about side effects. Let's take barbiturates on the other hand. Barbiturates can lower your blood pressure and stop your breathing.
Your heart stopped.
Stop your heart stop. This thing don't work. I'll do my best, but my best isn't very good. Barbiturates have a very narrow margin of safety between the effective dose and the toxic dose. And a better choice of medication would be temazepam, which is Restoril, or zolpidem, which is Ambien, as a sedative. Barbiturates is too close between the effective dose and the toxic dose. You need a wider margin between them. Now, drugs can be administered in many different ways, by mouth or intravenously, intramuscularly, rectally, or even as through the skin by patch or cream. The oral route is the most convenient, the safest, and the least expensive, and the most commonly used. Now, if a medication is taken by mouth, we want to know how quickly and how much of the drug reaches its effective target. If the pill releases the drug too quickly, the blood level may be too high. And if it's not quickly enough, much of the drug can be eliminated through the gastrointestinal tract before being effective. The drug manufacturers formulate their pills to release the drug at a desired speed. I'm going to give you an example, which I've given you many times before. Most of you are on aspirin, and you can go and buy 500 aspirin for $3 at Walmart with no problem. But right on the same counter, you have Bayer aspirin. And for the same $3, you might get 25 or 30 or even 50 Bayer aspirin. Why does Bayer aspirin cost more than regular aspirin? Aspirin is aspirin. The reason is that the Bayer people have put the aspirin into a soluble vehicle which immediately dissolves as soon as you put it in your mouth and your stomach. So you get a more rapid onset of the drug. If you're treating headache or pain, you want some rapid onset that's effective. So you use Bayer aspirin. But if you're taking aspirin for its anti-platelet effect, which most of us are doing to keep the blood from clotting, then it doesn't make any difference. So you just take any old aspirin. Now, the pills that you take by mouth, of course, can irritate the stomach wall, and sometimes they decompose in the acid environment of the stomach. But the manufacturer can coat the pill, and it's called enteric coating. And many pills, even the aspirin we talked about, are enteric coated so that they don't dissolve until after they get out of the stomach. It's just a thought to be kept in mind when you're taking any medication.